Thank you for choosing Kellerman Dental for your procedure. There are some things you need to do following your surgery to help with your healing and make your recovery less painful.
Now we move into the post-operative phase. The most common post-operative experience for our patients is relatively mild. After leaving our office following your surgery, we suggest you relax and limit your activity for the remainder of the day. You can start light activity the day after surgery if you feel up to it. For the first 2 to 3 days, avoid extreme exercise, heavy lifting, or anything that will cause you to strain. For post-operative soreness, you can take pain medication as directed by your doctor. It is important to follow the specific directions given to you by your doctor, and we can prescribe additional pain relief options if more severe discomfort is anticipated. If a bone graft had to be placed, the pain could be more severe and last up to a week. But again, following our pain control protocol should keep you comfortable. If you have been given an antibiotic, please continue taking it as directed without missing a dose for as long as recommended. To decrease post-operative complications, our patients are instructed that they must not smoke 30 days before or after their implant surgery. It is normal for some swelling to occur after surgery. It will be most noticeable the second morning after the surgery and then resolve within 1 to 4 days. To minimize swelling, use ice packs over the site 20 minutes on and 10 minutes off, as much as you can for the first 24 to 36 hours. It will be hard to place ice directly over the ridge, but placing it on your cheeks and lips adjacent to the surgical site will help reduce the swelling, accelerate healing, and reduce your post-op discomfort. Try not to eat until the anesthetic is worn off and you feel no numbness. After that, you can eat right away, starting with ice cream, soup, mashed potatoes, and other soft, non-abrasive foods. Avoid hard, spicy, acidic foods. You can eat as much as you want, but for the first week, never use a straw, as this causes negative pressure in your mouth, which can pull on the sutures and loosen things up. In a few days, resume your normal diet on the non-implant side, and don't attempt to chew against the implant side for 2 months. This is extremely important, especially if there is a healing cap peeking out of the tissue. Pressure on the implant during the first few months after surgery is the #1 cause of failure and implant loss during that time period. You may brush all of your other teeth anytime after the surgery, but you should avoid the site of the surgery for a week. If you need to clean near the surgical site, please gently use a Q-tip soaked in chlorhexidine mouth rinse that we'll give you. After the sutures are out, you may resume brushing near the implant site, but let comfort be your guide. On the day after surgery, you should apply the chlorhexidine directly to the implant site with a Q-tip or cotton roll rather than rinsing your whole mouth. You should do this twice a day. It should be the last thing you do in the morning before starting your day and the first thing you do before you go to bed at night. It is important that you do not rinse with anything else for at least 30 minutes after rinsing with the chlorhexidine so it does not get diluted. You should use this prescription rinse for at least 2 weeks. It is also beneficial to rinse your mouth out with a warm saltwater mixture after every meal. You'll be aware of the sutures and they will last for about a week to 3 weeks. Most of the time, we use sutures that dissolve on their own, but if we use sutures that need to be removed, we will let you know and remove them at a future appointment. If you normally wear a removable appliance which replaces missing teeth and it rests on the treated area, you should refrain from wearing it after surgery, as any pressure on the surgical site could affect healing and cause you discomfort. Our office will give you specific instructions as each case is different. If a bone graft or membrane needs to be placed to strengthen the site around the implant, you will be informed about special care instructions you need to follow. It is your responsibility to keep regular maintenance appointments. We will bring you back in a week to check the healing and remove any loose sutures. We will evaluate how you are doing and modify your brushing and eating as needed. Going forward, and assuming everything goes well with the implant placement, we will typically schedule you to come back to start the impression and restoration fabrication phase 6 to 8 months from the date of surgery. Your doctor will give you more specific instructions based on your surgery and follow-up. If you follow these simple rules, you'll have the safest, most positive experience after your procedure. If you have any additional questions, please feel free to call the office at 618-288-3535. If you are calling after hours, our emergency number is 314-743-9159, or you can contact us through our website.
Thanks again for choosing Kellerman Dental.